As more adults use prescription medications, a new study shows the rates of poisonings in children are dramatically increasing.
Despite child-resistant packaging, a new study in the Journal of Pediatrics shows more than 70,000 children a year are hospitalized for accidental drug poisoning. Dr. Zorba Paster joining us live in the studio. Good to see you in person.
It's a pleasure to be here.
So what age groups are at risk here?
Well, you've got the young kids, the kids under 6, and then you've got the teenagers, and you've got different personalities with each group, and the poisonings are increasing. And the most commonly things that kids are poisoned by are hydrocodone, we'll put those off to the side, and high blood pressure pills and cholesterol pills.
Wow. Now, why are they so dangerous?
Well, the teenagers are not looking for the high blood pressure pills and cholesterol pills. We know that. It's basically grandpa and grandma has it in their cabinet, or the parents have it in the cabinet. They look in the cabinet and they unscrew the bottle, and they're child-resistant bottles, right? Mm-hmm. You ever try to open those bottles?
Well, that doesn't mean they're child-proof.
Right, and so what happens is also a lot of people leave the bottle half open. Or they'll say to the pharmacist, I don't have young people at home, in which case the pharmacy will put it with a non-child resistant cap because they don't have people at home, children at home, but in fact they actually have children who actually come into their house. So this is a problem. Kids can open them up, and they do.
And what are the dangers of these medications? Why are they so
Well, high blood pressure pills, take too many of them and all of a sudden your blood pressure goes down. So a lot of kids will then faint, go to the emergency room. Cholesterol pills, and you take a few pills, it's not going to bother you. But overall they can cause muscle aches, and they're just not good. And that's the 6-year-olds and under. Now the teenagers, the big issue is hydrocodone and oxycodone, the painkillers. There are twice as many children and adults that are killed by prescription painkillers today than there are heroin and cocaine combined.
Wow, that's a startling
Prescription drugs are toxic in the wrong hands. They're very, very useful in the right hands. When we talk about prescription painkillers, it is critical to keep them out of the reach of children, and that means young children and teenagers, and that means not just the childproof top, but put them in a secure place so kids cannot see them.
What other suggestions do you have for parents?
Well, think about pills. Make sure your pills are out of the place. Think about safety. And just like when I had young kids, I would sort of child-proof the house. If you're going to grandma and grandpa's house, child-proof the cabinet. Go to the kitchen, go where people keep their pills, go to the bathroom cabinet, child-proof it, and make sure the pills aren't there, because basically it's not just falling into the glass table and ruining the tchotchkes, it's also taking the pills. So that's what I would do as a parent.
And it doesn't do any good to say don't take these pills, because that's going
Of course not.
to make the allure even
We were
better.
all children. Don't take these pills? Right.
Why not?
What do you do? What do you do if God forbid?
Call poison control, call your doctor, get help right away. Don't wait on it. When in doubt, call your doc and make sure you get it instantly.
I would say
That's what we do.
time is the issue.
Time is the issue, for sure.
All right, sir. Great to see you.
Good to see you in the studio for once. That's great.
It's great to be here.
Thanks for coming in.
He's actually a person. Thanks, Zorba.
Thanks, Zorba.